While people often mistakenly think that we have free health care in this province, it's in fact the biggest line item in the budget every year, by a long shot. For 2018, it's projected to be an outlay of more than $61 billion. That makes it a vital issue in every election campaign, including this one. Let's find out what the parties have to say about it with Deb Matthews. She is a former Minister of Health and Long-Term Care, co-chair of the Liberals campaign, and the former MPP for London North Centre. Christine Elliott, former Ontario Patient Ombudsman and the PC candidate for Newmarket-Aurora. Gélinas, the former NDP health critic for 11 years and the candidate now in the riding of Nickelbelt. And Mike Schreiner, leader of the Green Party of Ontario and the candidate for the Greens in Guelph. And it's good to have all four of you around this table here. Green is, I guess you didn't get the memo. Green is...
It's like the royal wedding, right? That was maybe
clearly the color of the day for guests. In any event, I want to start, before we get to what you all have on offer, and we'll have a good discussion about that, I want to get a sense, and let's start with the former health minister here, on how you feel Ontario is doing just in terms of the overall health of the population. We know, for example, Australia's life expectancy is longer than ours. In Canada itself, British Columbians have a longer life expectancy than Ontarians do. What's your view of where we are on that front?
So we're in very good shape in terms of the health of our people, but there's definitely more to do. But if you look at survival rates for cancer and various diseases, we're actually doing very well. But is there an opportunity to do better, to have a healthier population? Absolutely, yes. And that's why focusing on things like reducing smoking rates is important, increasing vaccination is helpful to keep us healthier. There are a number of things we need to do to be as healthy as we can be.
Where do you see us falling short at the moment?
Well, we don't really have a strategy for chronic disease management, and it's the biggest challenge in our healthcare system now. While we're managing acute care all right, but chronic disease management still needs a lot of work. We need to focus on prevention and wellness. We want to have a healthy population, so we reduce our hospitalizations. We don't have as many people who are frail that can't be involved in their society and in their workplaces. So there's a lot more work that needs to be done in that respect.
Gélinas.
I would say a bit worried. I mean, we know that we have an aging population and that comes with chronic disease, but we also know that for the first time ever in Ontario, our young people are not as healthy as when you and I were growing up. You look at the rate of obesity, you look at the rate of mental illness, you look at the rates of chronic disease that starts in children, and our youth are not healthy. Are not as healthy as we were, so that worries me lots. We have to look at this seriously. We have to look at health promotion, disease prevention. How do we, the social determinants of health, how do we keep our population healthy? And it starts with the kids, but it goes throughout.
Mike Schreiner.
Yes, Steve, I'm happy we're having this discussion tonight because I believe we need to transform our healthcare system to focus more on preventing illness and promoting health instead of just treating sickness. One of the reasons British Columbia does so much better than Ontario is they spend 3 times more per capita on preventing illness and promoting health than we do in Ontario. And we also have to look at the link between things like poverty and housing and how that affects people's health outcomes. We spend 3 times more money on health care than we do on social services, yet increasingly studies are showing that social services affect people's health outcomes as much or more than the actual healthcare system itself. And then finally, the built environment. We need a built environment that makes it easy and safe for people to live healthy, active lifestyles.
Let me pick up on that with you, Deb Matthews, because I mean, you and I both heard this a million times over the year where we spend this much on health and we spend this much on health promotion. And I'm not sure we got to do that, but we surely have to do this, don't we?
Well, the basic income pilot, I think, is a really good example of what we're doing, and we're studying this.
Just explain what that is
for
those
who don't know. So the basic income pilot is, we're piloting in several communities across the province, including Hamilton, where people can choose to go on a basic income pilot where they get significantly more money than they would if they were on social assistance. And we're tracking whether or not their health improves, whether their reliance on healthcare system decreases, whether they're actually better able to work or go back to school. So this is a really important pilot that's taking place. people from around the world are watching the basic income pilot.
Including her party, incidentally. I think the Conservatives have said they would keep it if they won.
Yes, they did. We're glad to hear that. So I think we're actually now getting very serious about tackling the social determinants of health. And that's why it's so important we continue with the work on homelessness prevention. We want to eliminate chronic homelessness because we actually know it costs less in our healthcare system, in our justice system, to provide people with a home and the supports they need to stay housed than it does to actually, than the status quo,
Sure.
right? So homelessness is actually very expensive. So there's a lot of work that's happening, and it's exciting to see. I think we're going to get some good results.
What did the PC party have up their sleeve in terms of trying to make a contribution to health promotion, have a health system that is less about sickness treatment and more about making sure you don't get sick in the first place?
Well, we certainly have several options. One is our dental care program for seniors, because we know that last year there were 61,000 visits to emergency departments just because of oral health problems. So we need to make sure that we can provide those care services to seniors, many of whom can't afford to go to see a dentist, so they end up in the emergency department. So we want to make sure that we can prevent those visitations to emergency departments.
Now,
and
let me
make sure
jump in
people
there
can
for a
be
second, because Deb Matthews will say we're covering under 25s and over 65s, and the NDP would say we're covering everybody. Fewer drugs, admittedly, but we're covering everybody. The PC party's only decided to cover the senior vote. Why is that?
Well, no, we support the pharmacare program as well, OHIP Plus. We've said that we would support that. We'd like to expand that to seniors as well, but we want to make sure that there's going to be money to do that because we know there's a huge financial hole in Ontario. We can't overpromise and underdeliver. Nobody wants that. We want to make sure that we pick the priorities, that things that we've heard from people the most, and be able to address those issues straight away.
Okay.
But the big problem we have, if I can, is you haven't got a platform. You haven't got any money allocated. We don't know where the money's coming from, but we sure do know that you're going to cut drastically billions and billions of dollars.
That is not true.
Until we see the money following the promises, it's pretty hard to believe them.
No. If I may,
Please.
We have 5 essential planks in our platform right now, and ending hallway medicine is one of them. We are very committed to making sure that people don't get treated in hallways, in storage rooms, and so on in hospitals. We want to make sure that they are going to receive excellent quality health care. We have costed it. We have told people only what we're able to do right now, and we have said that when we win government, we are going to have accountants come in to understand where the bottom is, because we don't know, as a result of what the Liberals have done for 15 years, we want to make sure that we can deliver on what we promised. So we have costed what we've promised so far, and we're going to have to wait to see how bad things are before we can promise anything more.
Let me just jump in for a second. Peter Bethlen-Felvey, your candidate in Pickering-Uxbridge, I think, this morning at a news conference downtown Toronto, said there will be a fully costed program before this campaign is over. Is that your understanding as well?
Yes.
There will be.
Absolutely.
Okay. Interest of equal time here. In terms of health promotion, what is the NDP like, what it's got on offer?
Well, I would agree with part of what Debbie has said, that homelessness is very important. You look at the Liberals have been there for 15 years. There's been very little done for affordable housing. You're homeless because you don't have a place to live. You can't afford a place to live. So we are committed to 65,000 new units. We are committed to 30,000 social housing. That is where you have support. So a lot of people with mental illness live on the street. Why? Because there isn't social housing for them available. We are committed to that. You look at keeping people healthy. You have 2.2 million Ontarians right now that don't take their medication as prescribed because they can't afford it. I have nothing against OHIP Plus for kids under 20, young people under 25 and people over 65. I want it universal. We'll do like 132 other countries that have Medicare. We will bring universal pharmacare out of a list of essential medicine, and same thing with dental. There are more than 4 million people in Ontario that don't go to the dentist because they can't afford it. It has become their badge of shame, where if you are poor, you cannot smile because you haven't gone to the dentist and you have bad teeth. How could that be in a province as prosperous as Ontario, that we let that continue? An NDP government would make sure that universal access to pharmacare and universal access to dental care, no matter your age, no matter if you're working or not, you're part of the gig economy, you will have access.
Let me get Mike Schreiner in with the Greens and what you've got up your sleeve on health promotion.
Yeah, well, I think one of the things that separates the Greens from the three status quo parties is we're not putting a Band-Aid over the hallway medicine issue. I mean, it is important that more investments go into that, and I support those investments that were contained in the budget. But there are three primary drivers we have to address. So one is primary health care reform. We need to make sure we have more and better access to primary health care providers. So that means more funding for community care centers, more nurse practitioner-led clinics, more integrated family health teams, because about almost half the people, 47% of people who go to emergency say they could have been treated at the primary care level and received better treatment at a lower cost if they could have accessed that primary health care. So that is critically important. The second one is why we're calling for a historic investment in mental health services, $4.1 billion over the next 4 years. Because I've talked to so many emergency room doctors, particularly in my home riding of Guelph, where doctors have said, I almost know the names of all the mental health patients who are coming and just being recycled through the emergency room because they're not getting the care they need in the community. So we have to provide that. I would like to see mental health ultimately be part of OHIP, and it would be publicly funded, publicly accessible to everyone who needs it. And then the final one is long-term care beds and alternative levels of care. We have a number of seniors who are in hospital who would be better cared for in the community if they could access those services. So if we can alleviate that pressure on emergency rooms, that would help free up hospital space and would be an important contributor to transforming our healthcare system.
Let me put one idea on the table, and Deb Matthews, I want to start with you because I presume when you were in cabinet, Deputy Premier, Minister of Health, whatever, at some point your government had a debate about something many other jurisdictions have looked at, and that is whether to tax soda pop, fruit juices, that kind of stuff. Because, you know, I think it's the case that if you put high enough taxes on smoking and booze and all that, you can inhibit some overindulgence. Did you think about doing that?
Yeah, we did, and when I was Minister of Health, we had a child obesity panel that really wrestled through some of those issues. One of the outcomes of that was calorie labeling. So in restaurants now, you can see how many calories in a Timbit, right? You can see how many calories.
You ultimately didn't go for the tax.
The advice of the panel was not to do the tax because it was seen as a tax on the poor. And so the advice we got from the panel was not to proceed with a tax.
I presume the PC party has no plan to tax fruit juices and soda pop.
That's correct. It is a tax on the poor, especially in a lot of northern communities, some of the fly-in Indigenous communities. People can't afford fruit juices and less sugary drinks, so they drink more soft drinks, which is not ideal, but they're barely coping with what they can pay for now.
Is that something the NDP would entertain?
I would tell you that if you look at the big five in health promotion, stop smoking, healthy eating, healthy weight, limit your alcohol use, and exercise. We are looking at all of that, including mental illness. We are looking at all of this. If you look at the policies that we have put forward, they have a health in all policies lens to them to make sure that all of those is taken into account. So does tax have a role to play? Tax has a role to play in alcohol consumption and cigarette consumption, and at some point in healthy eating, it will have a role to play. I come from Northern Ontario. I know full well how much it costs to bring 4 liters of milk out there. I buy it every week. The idea is really make healthy choices the healthy choice, the easy choice, and then it becomes so much easier. Calorie labeling, I brought that forward 6 different times before Deb finally brought it forward. Hallelujah, we have it. A little steps. It shouldn't be that hard to make step in health promotion.
Okay, but I'm not hearing you say an absolute no to a tax on soda pop.
We're not ready for that because the healthy alternatives are not there.
Okay, Mike Schreiner, I wonder if you... This is always a tough issue because on the one hand, governments want to promote a healthier lifestyle among the population for a whole bunch of obvious reasons. But on the other hand, you know, citizens don't necessarily want their governments sticking their nose in their business in every, you know, how much milk I drink or how much fruit juice I drink. Where do you find the balance on that?
Yeah. So I see it as a four-step process before we get to what I would call a junk food tax, which I think if we follow the four-step process, I would be supportive of. So first of all, we have to teach people about healthy eating. And so I don't like the name home economics, so maybe healthy living or something, but if we could reintroduce that back into the curriculum, so many young people don't even know how to use food, how to cook, how to eat healthy. So I think that needs to be part of our curriculum, first of all. Second of all is income. Income inequality is huge. And so I was happy that the government brought forward the basic income pilot, but we can't use that as an excuse not to raise social assistance rates right now. And so that's why we're calling for funding for rolling out a full basic income guarantee, because poverty and income inequality plays a huge role on this issue. And then the final point is to make sure that we make healthy foods more affordable for people. I mean, that's a huge issue. And so part of that for us is, let's support local farmers and growing healthy local food. Let's up the ante on the Local Food Act and actually require that a certain percentage of local healthy food be available in all of our public institutions so people can better access healthy eating. And then I think we can look at other mechanisms like taxes to encourage that behavior shift, because it has worked with alcohol and tobacco, and so it is a tool that's in our toolbox.
Okay, I want to just take the next couple of minutes and Sheldon Osmond, our director, is going to bring this graphic up because all of you've all got quite a lot of things to say about health promotion and healthcare and so on. So this is by no means an exhaustive list, but it is a list of some of the highlights in your respective platforms, and let's go through it. The Liberals pledged to spend, this was in the budget, an extra $822 million over the next year in hospitals to improve wait times, on top of the $19 billion they already spend on funding the province's hospitals. And included in that is $187 million for hospital beds, including new medical and surgical beds, mental health beds, beds for long-term care, and ventilated patients. That's the highlight of the GRIT package. The PCs are talking about $1.9 billion over 10 years for mental health, addictions, and housing supports, and they plan to add 15,000 long-term care beds over the next 5 years and 30,000 beds over 10 years. The New Democrat pledge is to increase hospital funding by 5.3%, which according to the party will be $916 million more dollars for this year alone. Within the year, they also intend to add 2,000 new hospital beds, estimated cost on that more than $300 million. Like the Tories, they want to add 15,000 long-term care beds over the next 5 years. They're aiming for 40,000 new beds within 20 years. And the Green Party, you've heard Mike Schreiner talk about that already, the focus on mental health issues, the pledge to invest $4.1 billion over 4 years in mental health services as a step to having mental health care coverage within OHIP. So you are all, you've all got something to say on all of this. And I guess just before we get into a healthy debate about it all, different priorities for different parties, different accents on different things. Why do you think the mix of what the Liberals have on offer is best?
Well, I think we have to look at the whole health ecosystem as opposed to just hospital funding. Hospitals are so important, but we don't want to have people in hospital who actually would be better cared for outside of hospitals. Sure. So building that capacity outside of hospitals, whether it's home care or supporting people in their own homes by, we've got money set aside to help people with the cost of cleaning the eaves troughs and shoveling the snow to help people keep in their home, stay in their home longer. We've got increased funding for house calls, which is a fantastic, it's not really an innovation because it's kind of going back to where we were,
back to the
but
future.
Keeping people out of hospital and getting them the health care they need in their own home. Building, thinking outside the box in terms of what kind of supports do people need as they age in communities where there are enough older people, it's possible to put in a nurse or a personal support worker to support people.
Okay, let me come at you with one follow-up question here, which is, you've heard the criticism before that there's almost $1 billion in the last budget for hospitals. Your critics would argue because you starved hospitals too much over the past 5 years under Kathleen Wynne's premiership, and therefore you're playing fast catch-up. Yes or no?
No. We increased hospital funding year over year over year. But we have to remember there's something really important happening in the province, and that is the demographic shift. So as people age, our healthcare system was built for when people had short-term, episodic, in the hospital to have their gallbladder out and out again. People now have much more complex diseases. There are more of us who are older. We need to retune our healthcare system and really think about delivering the right care in the right place at the right time by the right provider. So we have to rethink our healthcare system. But when there are people in hospital who should not be there, that tells me that we've got to build capacity outside hospitals.
Okay, Christine Elliott, let me get you to focus. I know that the biggest phrase used, it seems to me, in this election campaign has been hallway medicine. And all of the parties are looking to somehow end hallway medicine, maybe in different ways. What's the PC party's idea on that?
Well, one of the biggest ways to eliminate hallway medicine is to make sure that there are beds available in hospitals. So about 25% of all the patients in any given hospital at any given time are alternate level of care patients, which means they don't need to be in the hospital, usually frail elderly seniors, but they can't go home because there aren't enough home care supports for them, or there isn't a place in a long-term care bed. So if you're 85 years old and you have to wait 5 years to get into a long-term care bed, that's not good. And so that's why we have the emphasis on building 15,000 long-term care beds in the first 5 years and 30,000 in the 10 years thereafter. Because we know that we need to put people in the appropriate place. It doesn't need to be in the hospital. They want to be in their own home if they can. If they can't be, they need a long-term care bed that's close to their families too. Moving people far away from where their families are at that age is not right to people who've worked hard all their lives. So that's one primary way that we can deal with ending hallway medicine, is to create that flow through the hospital so people can actually be treated in a proper hospital room.
I think the NDP have been asking questions about hallway medicine actually for many, I was going to say years, but let's say months anyway. I know, I certainly remember you and Andrea Horvath asking questions about that. But what do you actually do to bring an end to it?
Well, basically, we started filing freedom of access of information over 2 years ago because we were going into our hospital and seeing the capacity challenge that we had. I think Ontario Hospital Association says it best, a system on the brinks. Our hospital, the cruel, like the jewel of our healthcare system, are on the brinks. Why? Because 6 years ago, the Liberal government made the decisions to give zero base budget increase. They give money to the hospital to bring in new programs, but the base budget was zero, 4 years in a row. First year, they coped pretty good. They implemented lean, they found some efficiency. Year 2, 3, 4 were disaster. 5 and 6, here again, not enough for the cost of living increase. Our hospitals are on the brinks. The Liberals are putting a one-time increase and then not. We will undo the damage done by the Liberal government and fund our hospital at 5.3% so that they can undo the damage. They can buy the new equipment they need. They can reopen beds,
I've got to jump in
opening
there.
2,000 new beds.
Because you are talking about a hell of a lot of money.
Yes.
And everybody wants to know whether or not you can afford that promise. How can you?
Well, we will, as opposed to the other two, we will ask people to pay their fair share. We will bring in an extra tax on the wealthiest, on people who makes over $220,000 a year, on people who have taxable income of over $300,000 a year. We will ask them to pay their fair share. We will ask them to pay a bit more.
That turns into the answer for almost every question you ask the NDP nowadays is we're going to raise taxes on those making $220 and $300 and corporations. They're all going to pay more.
Correct.
Profitable
corporation, not small business.
Indeed. No, you're leaving small business alone. But one does wonder whether or not all of that money gets spent twice and 3 times over, given the number of commitments the NDP has made on spending in this campaign. What do you say?
Well, our platform has been costed. So the Auditor General, who used to, Financial Accountability Officer that used to work at the federal level, has reviewed our platform, have seen the new money that we bring in, the money that we come out, and said that our platform is costed, which is way better than the non-existent platform we have from...
Well, he said it was reasonable until the $700 million mistake came out.
Yeah. That was a contingency fund that was put elsewhere. The contingency, we have not used the contingency in any of our platform, any of the costing. The contingency was there because we were told it had to be there. A mistake was done, no arguments there. But I can tell you that the $700,000 that was put in a contingency fund was never used. We had no intention of using it. It is there because it had to be there to be
Mike
to be on the safe side.
I'm going to get to Mike
was-
Schreiner in a second, but
Yeah,
you have to
it-
have a chance to
so
respond to some of the criticisms first.
700 million.
Yes. Is this
And
what I
it
said?
was
Yeah.
700,000, I think. But anyway,
Sorry,
and
700
it was an addition rather than a
Yeah.
subtraction. So it's a 1.4 billion year over year over year. So I haven't seen a revised costing from you.
No, they
from
did say the
NDP.
deficit would have to go up by $1.4 billion to accommodate the new reality.
So it seems to me, it just raises a competency question, I think, if you just
Well, it's still
instantly
smaller than your
add
deficit.
1.4. Yeah, but it was a mistake. There's also the other big mistake that was made in the NDP platform when they didn't include any of the allocations, including that were made in the calendar year 2017. So things like the opioid strategy, things like the cannabis strategy to support municipalities that when cannabis becomes legalized, a number of items of in-year spending were just wiped right out. And Andrea Horvath has said, yes, we did that on purpose. I just don't believe it was on purpose that you reduce services for people with autism or people with opioid addictions. I think there's a lot of questions that still
equal
need to be
time for the
answered.
NDP.
Oh, well, I can tell you that our platform has been costed out, that we are keeping the programs that were there, but a whole bunch of new programs that got announced in this budget, we won't. We will not continue. We're bringing pharmacare for everyone. We will not give kids $50 to go to the dentist. We are bringing a dental care for everyone. So what they have put forward and costed, we are not going ahead with this. A dental plan where a family gets $400 means that you still won't be able to go to the dentist because you don't have the money up front, and you will continue to have all of the problems. So we are not going ahead with the expenses they have put forward because we have our own plan that is there for everybody
Okay.
to see.
Mike Schreiner's waited patiently. You wanna
I
come in?
have.
Okay. You want to come in on why you have made the decisions you've made on health promotion and health policy?
Yeah, so I have to tell a little story here, and I think Andre Picard gets a little credit for some of it. Is
Globe and Mail columnist
Globe
on
and Mail
healthcare.
columnist. So, we're all sitting by a river, and you see some children floating down the river who need help. And these folks are jumping in to save those children, and it's a good thing they're doing that. But somebody, and that's the Green Party, is going to have to walk up that river and figure out why the kids are falling into the river in the first place. That's what our plan does. That's why we're emphasizing investing in mental health services at a historic level. That is why we're looking at how do we eliminate poverty and address those social determinants of health. That's why we're investing more in affordable housing and making sure people have a place they can afford to call home. And that's why we're the first party that's brought forward a proposal for dedicated funding for infrastructure, for cycling and walking, and for safe streets that's permanently a part of the transportation infrastructure budget. We're proposing 5%. So we can make our built environment safer for people to live healthy, active lifestyles. That's what's going to create the long-term solutions that are going to lead to sustainability in our healthcare system.
I do have to do one quick follow-up with Deb Matthews here, and I don't mean to sound like a
Just whatever.
just fill in the blank. I don't smart ass was what I was going to say, but you can't say that on TV. Is it a little problematic for you to be saying to the NDP your numbers are way off when the Auditor General thinks your numbers are fiction to begin with?
Well, there is a dispute, no
There is a
question about
dispute,
it.
yeah.
But I have to say, all the other parties have accepted our accounting rules. There's
Now,
not
that
a
is true,
party.
too.
Yes, that is true too. So to level the playing field, we're all. Except I have to go back to the Conservative Party because, Christine,
I like the way you pivoted there. That was very good.
I just have to say, there are, I think, 10 billion and counting in cuts that you have to make, and we are just. I mean, how do you
Where do you get
go?
10 billion?
Well, Doug
I've heard
Ford,
6. I didn't know about 10.
4% is $6 billion.
yes, but then there have been promises that have been
been a lot,
added through
yes.
the campaign.
There have been other
so
promises,
we're
yes.
counting now at $10 billion in cuts, and you can't cut 10 billion without drastically cutting into the healthcare budget, and that is the big credibility gap. That I mean, how can you talk about investing more when it looks and Doug Ford has said we need to cut across the board. I mean, he's admitted to that. I just don't know where.
Okay,
I don't
let's
know
see if we
where.
can get an
And I
answer.
have to say, if you were leader, I bet they wouldn't be talking that way.
I want to hear the answer to that
No
part.
comment on that one. But what I would say is we've been talking about efficiencies. And we know that in healthcare, we are spending a lot of money, $61 billion, but we're not getting the best value for our health dollars. So the Commonwealth Fund has said that. The C.D. Howe Institute has just said that. We know that a lot of money has been wasted. We're spending $8 billion on electronic medical records, and they still don't connect with each other. There's lots of other billions of dollars that have been wasted on canceled gas plants, on smart meters, and so on. We're not going to waste money, and we're going to spend taxpayers' dollars wisely. That's what we stand for.
$10 billion without doing more damage to the healthcare system than
we've already done.
I feel a bit uncomfortable asking you to defend it because I know you wouldn't want to do that. But that is your party position, to cut $10 billion. Health is half the budget. So you're talking about deep, deep, deep cuts to healthcare. And until it can be explained, then we can only assume the worst.
No, we are not. We are talking about finding those efficiencies. We're talking about putting money into the systems that really need help. Mental health and addictions is an area where we have committed $1.9 billion to match the $1.9 billion that's being committed by the federal government. We know that reaches across all ministries, not just in health. It affects justice, it affects education, affects many other ministries. So we know that we need to spend that money wisely. We know those young people need help. We've got 12,000 children and youth needing mental health services that aren't receiving them. Our goal is to make sure that everybody who needs help gets that help, and we need to find the savings that are there because we know we are not spending our healthcare dollars well.
But I have
So
seen what
the
efficiency look
1.9
like.
Yeah.
the $1.9 billion
10 years.
is over 10 years.
Exactly.
That is $1 billion less. We're promoting 2.1 billion over 4 years.
Yeah.
So your healthcare, your mental health platform is far, far less than anybody else is promising.
Yeah, it's a drop in the bucket on a year-by-year basis, 1.9 over 10 years.
Well, I think we need to set up a proper mental health and addiction system in Ontario, which we don't have. We just have money that's being spent here, here, and here, and it's not connected. It's not responding to the needs of children and youth. We had the Mental Health and Addiction Select Committee, where all three parties agreed on a number of steps, and I think only one of them has actually been implemented by the Liberals, which was on the opioids. There are many other steps that could be taken to coordinate the system much better and to fill in those gaps and make sure that those children, youth, and adults get the services that they need, and it's already been agreed upon by all three of the parties.
I agree with you, but we're the only one who's putting money towards the opioid strategy, $222 million on the opioid strategy, and I'm not seeing it anywhere else.
Okay, jumping in here because we got 2 minutes to go. Sometime here, sometime here. Go ahead.
Well, I have seen what efficiencies look like in our hospital. They went through 4 years of where they were supposed to find efficiencies. And what it looks like Léo Seguin, who spent 13 days in a bathroom because this is the only room that was available. And that room is still being used every single day. It looks like 50% of our hospital that are over 100% capacity. The safe level is 85%, and we have some at as high as 140% capacity. This is what efficiencies look like. I don't want any more of this. I want a strong and robust healthcare system, and that means investment, not finding efficiencies, not Rob Ford who says, I will leave no stone unturned to find privatization. I've seen what privatization looks like. It looks like if you're rich, you get care, and the rest of us don't.
Last 30 seconds to the leader of the Green Party.
I think people want honesty. And to sit here and run around for the last few weeks and say efficiencies, 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 without offering any details. I mean, the one thing I'm proud of is we've talked about detailed ways we could save money. We've also talked about details about how we could raise additional revenue. I think voters want that honesty from their politicians. They want straightforward answers to the challenges we face, not vague slogans, because vague slogans have real impact on people's lives when the cuts come home to roost.
And that is the last word on our program tonight. I want to thank all four candidates for coming. Well, you're not a candidate anymore. I want to thank three candidates and the former Deputy Premier of Ontario for coming into our studio tonight and having this discussion about health care. Thank you so much, everybody.
Thank you.
Pleasure.
Thank you.
You're welcome.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.